Next, let's square up the USA view. Older gay men are getting more STIs than ever. It's 2024. What's going on? Experts warn of a concerning trend, rising rates of sexually transmitted infections, STIs, among older adults. Ahead of the European Congress of Clinical Microbiology and Infectious Disease in Barcelona, infectious disease specialists emphasized the urgency for action. In the United States, STIs among individuals aged 55 to 64 have more than doubled in the past decades. Studies show gonorrhea cases nearly quadrupled in just a 4-year period from 2015 to 2019. A new study reported in England is doubling of the gonorrhea and syphilis diagnosis in over 45 age group, and it's primarily affecting gay men. Professor Justyna Kowalska from the Medical University of Warsaw, leading the research, attributes the surge of various factors, including the craze of dating apps and the use of erectile dysfunction medication like Viagra. Additionally, societal shifts such as the rising divorce rates and older delaying sexual activity contribute to the trend. Limited access to sexual health services and the stigma surrounding STIs further exacerbate the issue, as older individuals and the healthcare providers often avoid discussing or seeking help for these infections. Kowalska emphasizes the importance of healthcare providers engaging older individuals in discussions about sexual health. News reporting highlights an Amsterdam campaign success in significantly reducing HIV transmission rates, with only 9 new cases reported in 2022. Their approach included a comprehensive awareness campaign targeting older and especially queer demographics. The Broward age demographic for the LGBTQ+ community trends significantly older, so this news is very important to this region of the country. You know, it's so apparent in this. It's interesting because I just had a conversation recently with a caseworker who does work in the community, and she works primarily with a hetero community and extremely highly sexual individuals. And they have no knowledge. The education is truly not there. We've had conversations with people in the community about talking to their doctors about these. And if you think about it, in our medical systems, we have 15 minutes with our doctor. If that. Yeah. Right. So you want to talk, you have time to talk to the nurse, or you're going to talk to the medical assistant drawing your blood. You get 15 minutes with a doctor and you're out the door. And a lot of times people are very ashamed. They're stigmatized. They don't want to talk about these things or these issues. Or if they do want to talk about things, you know, the doctor wants to know, well, why do you need to be on doxyprep? Why do you want to take that? You know, and it shouldn't be a question of why. It should be, here's your prescription. Thank you and have a good day.
Hello.
Right?
Yeah.
Let's talk about, you know, and let's start talking about, our physicians need to start talking to each other and our patients specifically about their sexual health. Sexual health is so important. We should be here for pleasure, not to be stigmatized for what we want to do.
In the early days of HIV, when there was really no PrEP, AZT was really your only option. There was a high rate at like places like Century Village.
Right.
And they couldn't get them to come because of their generation. Then, you figure 20, 30 years ago, those who were in their 70s and 80s really, you know, did not grow up in an open environment about sex. They just didn't talk about it. But because of Viagra and, you know, and whatever died, and so suddenly I want to be active, so I take a Viagra and I hire a hooker.
Right.
But no one was talking to them and educating them, and they couldn't get them. When the social services went there and some of the HIV organizations went there, they wouldn't let them in, basically. So what they did is at the holidays, they told them that your grandchildren are going to be down here. We need to keep them safe. So the grandparents brought the grandchildren in, educating the older community as a trick, and it actually worked because they went with them and they were able to be educated without even realizing, because they couldn't get in any other way. So, you know, we've come a long way with it, but I'm a little concerned that it only went from whatever they said, 55 to 64. Do people stop having sex after 65?
I hope not.
I hope not.
Are you still having sex?
I am, but I'm not there yet. You should see, if Al were still here, this would be a great moment for me because we're the same age.
Oh my God.
Do you remember when we did a story a while back about the villages and how they were like the number one place for gonorrhea and chlamydia, right? And I was like, you go, old people bumping uglies, doing your thing.
With their scrunchies on there.
With the scrunchies, with the loofahs, on their golf carts, you know? But get educated, folks.
Yes.
You know,
Right.
you don't want to walk around scratching yourself and stuff.
No.
But, and I know this talks about that age group, but I also think about STIs as far as a country. I want to say it was 21. I'm not sure the year, but we had 20 million STI infections in the United States.
Wow.
10 million of those are from the ages of 13 to 29.
Ooh.
Wow.
Now, obviously we have an older population here, but you look at a countrywide statistics,
Yeah.
half of the STIs in the country are from a very young population.
Yeah.
And we're not saying have less sex. We're not
No.
saying that.
No.
We're saying
informed.
do it safely. Do it with people you trust. Do it with contraceptives. That's
Ask questions.
boom.
Ask questions.
Right,
Know
like,
your
what's your
status.
name?
I mean,
Who are you?
Right. So I can follow back later with the
Have you showered
results.
today?
How do
You
I
know, these
tell
are
you?
questions that
Right.
you ask.
No, but
Right.
it's serious. Like people just don't ask,
Yeah.
you know, and you get into relationships and situations and you have no idea.
Yeah.
I was on one of those dating app things, you know, and somebody was like really hot to get together and he was really cute. And we got as far all the way down to, he said to me, as he asked where I was staying in a hotel, he said to me, "Are you clean?" Which immediately, you know, and I was like, "What exactly do you mean by that?" Because I do shower,
Yeah.
knowing what he was going to say,
Exactly. Yeah.
and I, you know, responded, and I gave the whole undetectable stuff, and he goes, "No, thank you," and blocked me. And I just wanted to say to him, "I'm being honest. I could have easily lied to you.
Yeah.
So just because they're not telling you, or they're telling you, they could be lying.
Completely.
So you need to get yourself educated. You need
So right.
to know what you need to do. You don't have to trust me. I've had that conversation with you. Don't trust me. This is my reality, and this is how I believe. But go online, talk to someone you trust, talk to a pastor, talk to a doctor, but have a conversation because ignorance is not an excuse for getting HIV
At all.
I think it's important for, you know, people in the community as leaders, you know, that we're upfront and have these conversations. You know, I remember growing up in the 80s and, you know, when the AIDS epidemic was at its height and how scared I was as a kid. And, you know, and I remember coming from a conservative Republican family of, you know, just don't let this happen to you. Don't let, you know, and it was so instilled that fear that even to this day, sometimes I'm always a little like hesitant, you know, just to be even freer. And it's something that I continue to work on for myself.
You're traumatized,
but it is.
Right.
It's very traumatizing, and growing up and seeing your friends dying and hearing about people and not understanding this disease. So, you know, when it gets to this point, there is a certain freedom and sort of, I feel a little bit more relaxed. Like, you know, we're on to something here, and you know, but you have to still keep continuing to educate people on this because there are people that are not being reached, and it's very important for that. So, you know, for all the work that Holy Cross does, it's just so amazing that you're in the community doing that.
Yeah.
So,
Yeah,
thanks.
because
And
it's so needed.
I think it's important also to think about the trauma informed, you know, just understanding where that comes from.
Yeah.
Before you can have those conversations, sometimes you have to deal with other things before you can actually have that conversation with an individual.
Yeah.
Yeah.